Hello everyone, I'm Dr. Abhishek and I work for Lady Harding Medical College as Assistant Professor in Department of Radiation Oncology. So October is celebrated as Breast Cancer Awareness Month globally, and because there is a reason that breast cancer is most common cancer among women globally, and in India also we have the same kind of statistics that in women breast cancer is most common cancer. Although we have, changed from an era of radical surgery to the conservative surgery, and now we can save the breast by just removing the area of the breast which is affected. So this is a lot of technical advancement has taken place in past few years as far as the treatment is concerned, technology is concerned. So I will just talk about brief about various factors which is causing breast cancer, what are the sign and symptom of breast cancer, what are the treatment modalities available, and what changes we have seen over past few years. And one of the most important thing, how to make people aware along with the screening practices and how you can make yourself aware so that more and more women can go for the screening so that we can detect breast cancer at early stage and we can cure it completely. So coming to the most important, which is education, everybody needs to be well aware about sign and symptoms, how it happens. So as far as the risk factor is concerned, if somebody is a woman or female, they are at risk. So early menarche, which is starting of menses, is called menarche. So somebody is having early menarche and menopause when you have stoppage of menstrual period. So this is called menopause. So in breast cancer risk, you have early menarche if you have late menopause, so that you are exposed to the estrogen, which is a female sex hormone, then early, late age of marriage, late age of childbirth, and any situation which is causing, unopposed estrogen activity in the body may cause breast cancer. So now in India, the worry is that now more number of young women are coming and diagnosed with the breast cancer, and they are coming to the hospital for the treatment, and their biology is different, which is something called triple negative breast cancer, which is very aggressive. And in spite of all the treatment they don't have, good prognosis. So you need to aware about the risk and sign and symptom, which is any lump inside the breast needs to be investigated, and you must see the oncologist whenever you find any lump in your breast, any mass, any discharge in the nipple, any blood discharge from the nipple, or any skin changes over the breast. So you must see a doctor. And all lumps are not cancerous, but most of the cancer starts with a lump. So whenever you find any lump or any kind of swelling or mass, you must see your doctor. So now what is recommended for screening, which helps you to detect breast cancer at early stage? Worldwide, three kind of methods are generally advocated. That is, first is breast self-examination. Second is clinical breast examination. Breast self-examination is examining your own breast, and the ideal time recommended is 7 to 10 days after your menses. But as far as the evidence is concerned, it is recommended that it doesn't help you to reduce the mortality from breast cancer. And same with the clinical breast examination, although Government of India for the population-based cancer screening recommends to go for clinical breast examination every 5 years in a woman of age group 30 to 65. So what is ideal if you visit a hospital and if you want to get your breast cancer screening to be done, it is advocated that you must go for mammogram, bilateral mammography, which is kind of X-ray of both the breasts. So when it should be done, the ideal age is 40. You can start after the age of 45, and up to 54 you need to do it every year, and after 54 you can do it every 2 years. And if you have a family history of breast cancer, then you need to consult your doctor, for the recommendation of early breast cancer screening. So you can start in 30, and when you have more of a genetic predisposition, that they have a different guideline. So you must need to consult your doctor for that. Coming to the treatment, mainly surgery is the main treatment for breast cancer, followed by chemotherapy and radiotherapy based on your histopathology report, and based on your receptor status, you need to take the hormone therapy. Now we have moved to an era where we have started talking about immunotherapy. So there is an advancement in the treatment where we have moved from the hormonal therapy, chemotherapy, to the immunotherapy. Likewise, I said, as far as the surgery is concerned, from the era of the radical surgery, complete mastectomy, now we have come to the era of breast conservation surgery. But when breast cancer is possible, when you present to the hospital at early stage. So if there's an advantage of being aware and detect the cancer at early stage, that you don't need to sacrifice your whole breast, just tumor to be taken out with the adequate margin, and you can help to preserve your breast, which helps in the cosmesis. So this is the new era. And coming to the radiotherapy, you initially used to treat with the cobalt. Now is a technological advancement, and we are now come to the era of the IMRT, IGRT. So VMAT, these are the specialized technique. And now many one center is also treating with the proton beam therapy. So you need to consult your doctor what is best kind of therapy for you. They need to decide. So if you have any kind of issue, with the breast lump or any information, if you want, you need to consult your doctor. And most important, during the month of breast cancer awareness month, I need everybody to be more aware about this breast health, and please go for the screening if you are eligible as per your age, because it saves life. There's only one way. If you detect it early, the treatment, you can start early and you can save your life, minimize the complication, decrease the morbidity and the mortality due to the treatment and due to the disease. So although in the COVID time, it has affected the whole healthcare system, and cancer care system is one of the worst affected. In spite of all this difficulty, now we are advocating that breast cancer, if you want to protect yourself from breast cancer screening gives you a fairly good chance to detect it early. So during this pandemic also, go and screen yourself if you are eligible for it, and try to detect it early, because it's a life saving. Thank you very much. I congratulate again Health Life for this opportunity, and please make people aware time to time about the different cancer. Thank you.